Hello, everyone. Hello. Hi. Hi, everyone. So I'm Tiffany. So I'm going to use a slightly different approach from the previous two speakers. So we're going to use 3 case studies to illustrate our observations in our projects and our reflections on these 3 case studies. So who are we? We're Hong Kong Jockey Club Disaster Preparedness and Response Institute, and we're established in 2014. And our work focus includes, obviously, community resilience, promoting community resilience in Hong Kong, and continuous professional education and training in areas of disaster preparedness and emergency medicine amongst healthcare professionals in Hong Kong. And also we do a little bit of policy recommendations, such as policy briefs in Hong Kong, in the context of Hong Kong as well. So you might ask, what are the disaster risks in Hong Kong, actually? You only hear about typhoons in Hong Kong. You're right. We have a lot of tropical cyclones. For example, we have an annual average of 6 cyclones every year. We have a lot of floods, especially in the low-lying areas of Hong Kong. And we also have landslides because we have a lot of rain. And we're also susceptible to fire emergencies and infectious diseases, as you can see from the example of SARS a few years ago, well, more than 10 years ago now. Our exposure also include high population density and the aging population. We also have a very complex transportation system, and we rely on water supply from Hong Kong. So if that is endangered, then the whole of Hong Kong will be exposed as well. And we also have a nearby nuclear plant. So our community campaign on disaster resilience aims to increase community resilience through individual capacity and knowledge enhancement, and also to enhance local partner capacity to ensure sustainability. So today, I'm going to start by describing 3 different projects we have with 3 different local NGOs in Hong Kong, targeting at 3 very different but special populations in Hong Kong, and then describing some common challenges we have identified from the 3 projects and some methods used to overcome the barriers. I realize the 3 populations we'll be talking about are very different and very diverse. Hence, these are only some observations we've had when doing the projects. So the first community campaign on disaster resilience is done with people with hearing impairments. So for the projects, we've done a fire preparedness workshop and drill with the target population. And we also did a sign language fire preparedness and evacuation video. We also did a seminar on inclusive disaster management with other similar stakeholders in Hong Kong. The second project is a flood preparedness campaign in the Tai O community. Tai O is one of the last remaining fishing villages in Hong Kong, and it is of a very low seawater level, so it's very susceptible to floods when there is a lot of rain in Hong Kong. So in Tai O, we did a training of trainers project, training local community groups and other stakeholders. We also did a community engagement activities to promote flood preparedness measures, such as by the means of a carnival and mobile educational booth. We also did a survey on community awareness and knowledge on flood response mechanisms in Tai O, such as, and also did policy recommendations ultimately. For the third project, we did an emergency preparedness campaign for people in recovery of mental illnesses. So we did a mobile educational booth targeting the general public, and also training of the trainers and training those with mental incapabilities to educate the general public. And lastly, we did an elementary first aid course, such as physical first aid and psychological first aid, to increase self-protection capabilities. So these populations are actually generally aware that they are of disproportionate risk they face, and they are also aware that they can be slower in responding to different hazards and warnings, such as towards fire alarms for the hearing impaired and mentally compromised in this example. As for the case of empty nest homes, the elderly have been living in the community for most of their lives. Hence, they are also well aware of the hazards, which are heavy rains and floods. But there are still difficulties in enhancing resilience in the communities due to the following number of reasons. Firstly, the mode of knowledge perception. They only trust persons with authority within their communities, such as iconic personnel that, for example, know sign language for the deaf community, or community leaders in the case of the elderly. This reliance leads to the general refuse to trust outsiders when delivering disaster preparedness messages. Second, the context and activity content must be targeted at the disability in order for the populations to accept the messages without doubts. For the elderly, the threats must be life-threatening enough for them to take into account and prioritize as needed. Lastly, such populations' needs are easily forgotten and not prioritized, as there are a lot of difficulties in implementing the interventions and activities. For example, safe and secure environments and slow tempo of activities are required for interventions for those who are mentally compromised. Hence, a longer project duration is required and require a longer time to see the actual impacts of the projects. Secondly, for working with elderly, it takes a lot of incentives such as souvenirs to mobilize their participation in such activities, hence might not be favorable by the donors. Hence, we have found that more efficient and effective programs require commitment at all levels. Most importantly, to engage target stakeholders at program planning stages so as to be clearly informed of their needs and in order to develop better methods of delivery. For the mental health NGO, for example, they regularly have meetings with their service targets and hence can naturally involve them in all stages of planning for their projects. They also adapt a TOT model where their service targets are actually trained to provide disaster preparedness education and individual disaster preparation to the general public, so as to also boost their confidences and increase social inclusion. Tayo is a very political community where they are very protective of their own communities and the different roles of local services, hence are not supportive of external sustainable development projects. The network building process of the project was hence very long in order to fully understand the social structures. And to identify the key stakeholders in order to link them up to work together. Firstly, it is imperative to involve all key stakeholders in order to work effectively through the key stakeholders. Children, for example, are involved to disseminate messages such as a form of social mobility, and messages have to be easily understood and related directly to their daily lives in order for them to accept the messages. Lastly, it is important to be open-minded and be creative in methods of delivery and dissemination of messages, and using of existing resources and networks. Lastly, we found that it is important to be determined and not to give up because of the long processes it might take for the projects. Lastly, we just like to bring into light how our observation goes into the suggestions from the Sendai framework of DRR. Disaster risk reduction practices need to be multi-hazard and multi-sectoral, inclusive and accessible in order to be efficient and effective. And also, persons with disabilities and their organizations are critical in the assessment of disaster risk and in designing and implementing plans tailored to specific requirements. Thank you.